Following is a paid informational program. The views and opinions expressed are not necessarily those of the staff, management, or advertisers of WOBL Radio.
It's time for the Nordcast here on WOBL, and here's your host, Nord Center CEO Don Schiffbauer.
Hello, everyone, and welcome to our second episode of the Nordcast. And my name's Don Schiffbauer, and when I'm not moderating this fantastic podcast, I am the CEO of the Nord Center. So for those of you that may not be familiar with our agency, the Nord Center is a nonprofit community behavioral health center headquartered in Lorain, Ohio. We're one of the largest providers of behavioral health in Lorain County. We also have a footprint in Huron County, and it doesn't matter where you're from, anyone can receive services from our team of skilled clinicians, regardless of their ability to pay. This year, we are very excited to be celebrating our 75th year. Our agency has 5 core programs. They include adult behavioral health, children and adolescent behavioral health, crisis services, sexual assault services, and including rape crisis for both adults and children, and residential services. In the coming episodes, we'll have an opportunity to explore not only what these programs are and who they help, but also the positive impact they have on the health of our community. We'll also highlight the relationship that we have with other agencies in our community and how those important collaborations are centered around you. In today's episodes, we're going to explore child and adolescent behavioral health, including what services are available, who can benefit from them, and most importantly, how can you get those services? Anyone who is a parent, grandparent, guardian, or person that works closely with kids knows that we worry a lot when something is not right for our children. We want to help them, but we always don't know how. So first and foremost, let me say that the Nord Center is just one of the resources in our community for getting those kinds of questions answered. We will expand on that and the other available resources in Lorain County in a few moments. To tell us more about these resources, I'm very excited to welcome our 2 guests, Brooke Sherman, the Director of Counseling Services at the Nord Center, and Rebecca Jones, Director of Child and Adolescent Services at the Mental Health Addiction and Recovery Services Board of Lorain County. And over the next 30 minutes, you will hear about a variety of services designed to support our youth and their families. We'll be right back.
This is the story of a very special woman. Just a few knew about her superpowers. In a matter of seconds, she turned herself into a great mathematician. She masqueraded as a regular person at work, but as a superhero at home. Everyone knows her as Gabriella. I still call her Mom.
Your hero needs you now, and AARP is here to help. Find the care guides you need to help, complete with tips and resources at aarp.org/caregiving. Brought to you by AARP and the Ad Council.
Victor deployed for the first time to Afghanistan in 2003. He sustained a moderate traumatic brain injury. One of the most important elements of caregiving is taking care of yourself.
For many military veteran caregivers, their caregiving journey starts earlier in life and lasts longer. Visit aarp.org/caregiving for a free military veterans guide to navigate your caregiving journey and better care for your loved one and yourself. Brought to you by AARP and the Ad Council.
Hey, Dad, your prescription will be ready in just a minute. Hey, Dad, your laundry will be ready in just a minute. Dad, your lunch will be ready in just a minute.
Hey, honey, why don't you take a minute?
When you help care for a loved one, you give them as much time as you can. But it's just as important to take time for yourself. AARP can help. Find free care guides to support you and your loved one at aarp.org/caregiving. That's aarp.org/caregiving. Brought to you by AARP and the Ad Council.
Don't let biased algorithms or degree screens or exclusive professional networks or stereotypes. Don't let anything keep you from discovering the half of the workforce who are stars. Workers skilled through alternative routes rather than a bachelor's degree. It's time to tear the paper ceiling and see the stars beyond it. Find out how you can make stars part of your talent strategy at tearthepaperceiling.org. Brought to you by Opportunity at Work and the Ad Council.
All right, everybody, we are back. And to do a deeper dive into what children's behavioral health care services are, I'd like to welcome our first guest, Brooke Sherman. Brooke, tell our listeners a little bit about yourself and what your role is at the Nord Center.
Well, hi. Thanks, Don. I have been in the field of mental health for about 23 years, and most of that has been in child and adolescents. I started out as a child and adolescent counselor doing intensive home-based services, but I've also done school-based and outpatient. For the last 12 years, though, I've been supervising or doing administrative work in the community mental health field, and so that has led me to where I am today as Director of Counseling Services.
That's awesome, Brooke, and we're very happy to have you here today. So I'm going to start off with our first question. So say I'm a grandparent and I see my adult child struggling with their child. What's the most helpful way to suggest that the Nord Center may be able to help them or get them directed to other resources within the community?
Sure. Well, as you know, it probably depends on what kind of relationship that you have with your adult child and or grandchildren. We always want to say that how you approach something is really important. And how you can approach it is to come from a place of concern. You can say, I've noticed, or I've recognized recently, maybe that, little Susie or little Johnny is feeling a little more anxious or depressed lately, or they seem like they're uncomfortable, or they're making statements that just seem like, they're having a struggle in something. So we want to be able to, approach them in that manner, just like you would if you see a child or a youth have a physical symptom. You might say, you might need to take them to the doctor. We want to be able to just kind of mention, hey, there are professionals out there that maybe you can talk to see if, there's some help that can be had there. And one of the ways to do it is you can walk right into the Nord Center. We have walk-in assessment appointments every day of the week and get started. You can get started that way. Or you can suggest maybe even to call, like the mental health board and see what other services are there.
Boy, that seems the ability to be able to come in the same day when either it works for your schedule or I'm assuming it takes a lot of courage for some of our youth and adults to want to come in and seek services. Being a young person now seems even harder than it was when I was a young person a very long time ago. Growing up due to virtually 24/7 pressures of fitting in, both in person and on social media. And I said this the other day, when I wanted to get away from a situation, I got on my bike and rode off. Yeah. But with social media today, that's a little bit more difficult. How do I help my child navigate and manage this? And additionally, what should I know about this and how can I keep my child safe?
Yeah, and nowadays to navigate things like technology can be very difficult, even as, for me as a parent too, right? I think the most important thing to think about is, sure, technology is good, and there are good things that can come out of technology. Like recently, one of my sons, they utilized technology to learn how to whittle, like carve wood, which, you can find out interesting things to do, right, with technology. But there is that downside to technology, right, where there's cyberbullying or maybe people that are trying to get your personal information or even take advantage of youth. And so I think education is really important. So you as a parent can educate your child, like we don't give out our personal information. If somebody starts to ask you questions that are making you feel uncomfortable, you need to leave whatever site or chat area that you are at and come and tell somebody about that. I also think it's good, technology is great, but getting your children involved in other activities too that aren't necessarily based in technology is a way to kind of navigate their belonging needs too. So if they're interested in art, are there things that they can get involved with? If they're interested in sports, obviously you can join, a sports team, things like that. Also putting limits. So limits are really important for technology, like limits such as only utilizing devices in common areas where there is an adult supervising and monitoring. Now for older kids, that might be a little bit different. It might look different. It might be about turning your device in at the end of the night so that they're not in the bedroom, in their bedroom all night online doing something. That could be another way to save them.
So Brooke, speaking about the older child or the adolescent, I've heard that depression is, we know that depression as being more than just being sad. And, what does depression look like in an adolescent versus what, we may see in normal adolescent behavior? And how does a parent, guardian, or friend or loved one discern that?
Right. It can be difficult because, in normal adolescence, right, kids have bad days, or you're having different developmental changes that could cause, a child to have different mood swings or mood changes just in general. The thing I like to think about when you think about depression and any big problem is you want to think about the frequency that's going on, the duration of the symptoms that you're seeing, as well as the impact. So you want to see, is it impacting my child's functioning in any ways? So for kids, depression in particular, sure, they could have a sad mood, but they also might have more of an irritable, agitated mood. They might, and it's not just about them snapping at you, every so often. Maybe they're snapping at everybody all the time. So that's where that frequency and duration comes into play. Also, very much, we know as you get older, you want to spend more time with peers, right? Well, if you notice that they are withdrawing even from their peers, and they're doing that for long periods of time, then there might be something up. And obviously, if they're making statements like, I'm stupid, or I can't do anything right, but they're making those statements a lot, or definitely, if they're making statements about, I wish I wasn't here anymore, or I don't want to live anymore, obviously there could be some suicidal ideation coming up. And I know Rebecca is going to talk a little bit about crisis services and what to do in a crisis, but you need to look at those things and those patterns. And that might be the time to just express your concern and then reach out to a professional.
Well, thanks. That's, picking up on those phrases or those subtleties that may not be normal to your child and adolescent are key. We're going to take a quick break, but when we come back, we're going to pick up our discussion with Brooke, and we're going to talk to Rebecca Jones. So don't go away.
There's nothing like our Great Lakes. And thanks to Adopt a Beach volunteers, more of our shorelines are healthier, safer, and beautiful. Alliance for the Great Lakes wants you to join this movement with thousands of others that get out each year for beach cleanups that really make a difference. About 85% of beach litter is plastic, and with your help, we're cleaning it up. It's fun, easy, and means so much. Learn more at greatlakes.org/adopt. Join us on the beach.
For many servicemen and women, the battle doesn't end when they come home. And I know, because I too struggle with the invisible wounds of service. Pups for Patriots and Sam literally changed my life. If you're a veteran or know a veteran struggling with post-traumatic stress or a traumatic brain injury, go to AmericanHumane.org to learn more about the Pups for Patriots Service Dog Program. Let's give our veterans a fighting chance.
A message from American Humane.
Do you want to give back to an individual with disabilities and help change a life? The Guide Dog Foundation and America's Vet Dogs are seeking volunteers to help raise future guide or service dogs. Puppy raisers provide loving homes for puppies until they are old enough to begin formal training. Help raise an adorable pup into a future guide or service dog for a person who is blind, visually impaired, a veteran, or a first responder. Visit puppy.guidedog.org to learn more. That's guidedog.org. Sponsored by the Guide Dog Foundation.
At Doctors Without Borders, we believe the best medical care knows no boundaries. We responded to the pandemic around the world, including right here in the United States. Because of 6 million supporters who stepped up in this time of crisis, our teams could train health workers and vaccinate those in need. Independent and impartial, we respond at a moment's notice with medical care where it's needed most. We are Doctors Without Borders.
All right, and welcome back to our show. Before we get on with the show, I'd like you to mark your calendars for Sunday, August 16th at 9 a.m. when the Nord Center will be holding its first ever Mind Over Miles 5K race and 1 mile family fun run. It will be at the Burr Oak Reservation in Elyria. Registration is up and running, pardon the pun, for both runners, walkers, and sponsors. And just a point of clarification, Sunday, August 13th. Registration's open today, and you can learn more by visiting the Nord Center's website at nordcenter.org for more questions. All right, Brooke, I've heard of psychiatrists. We've heard the term psychologists, counselors, social workers, and therapists. Can you give us a brief description of who these people are and what the difference is, what their difference is when they are working with our children?
Sure. The main difference in these professions have to do with their focus or level of education or their scope of practice. So all of them are mental health professionals. Psychiatrists, for instance, have medical degrees, and they can prescribe medications that might help to reduce or alleviate mental health symptoms. Psychologists also, they have doctoral degrees, and they, depending on their type of study, they could be in clinical practice and provide counseling. They could also administer different psychological tests, intelligence tests, or other aptitude tests, and they could give a diagnosis and then give treatment recommendations based on what is in research is the most effective treatments for someone. Counselors then have master's degrees. They are licensed then usually by a state board, and in Ohio it's the Counselor, Social Worker, Marriage, Family Therapy Therapist Board. Yeah, that's a mouthful. And so they can provide, mental health assessment, they can diagnose, and they can provide individual or group treatment in a variety of settings, such as outpatient settings, school-based settings in the home, and inpatient as well. Social workers, what is really neat about social workers, and I'm saying that as a licensed counselor right now, what is so cool about that is you can get a bachelor's degree and get a license as a social worker in practice, which is wonderful. You can work within a social service agency doing a variety of things. You can work in a hospital doing various things too, discharge planning and linkage and referral. You could also have a master's degree and get a social work license too, and then you can do very similar things like I just described as a counselor. So you can do mental health treatment with individuals and groups as well. So there's kind of a wider range, a variety if you become a social worker.
Well, it sounds like agencies, including ours, have a lot of resources in terms of clinical skill to assist with child and adolescent services. Yeah. And I appreciate you sharing all this information, but now I'm going to turn it over to Rebecca Jones and bring her into the conversation. Rebecca Jones is the Director of Child and Adolescent Services at the Lorain County Mental Health and Addiction Recovery Services Board. Welcome, Rebecca. Would you please take a moment and tell us a little bit about yourself and what you do at the Mental Health Addiction and Recovery Services Board?
Absolutely. I will not, however, tell you how many years I've worked in the field like Brooke did. You can only guess that it might have been a year or two longer than Brooke. So I'm a licensed counselor, and I started out doing direct service. I've worked with adults, families, children, and adolescents throughout my career on an inpatient as well as an outpatient basis. I've been at the board roughly 2.5 years now, and really my role at the board is to plan for services for adolescents and children, evaluate the current services that we have, and seek funding for additional services. Our board really is working on developing a recovery-oriented system of care. We're looking across the county for the needs of every resident of our county to make sure that their behavioral health needs are met on time, when they need them, that they have access in a timely way, and that they have the right level of care.
So, Rebecca, in your daily responsibilities to ensure that our community has access for behavioral and substance use disorder services for our child and adolescent, beyond the Nord Center, what other agencies in Lorain County serve children? And more importantly, how can I myself or somebody else that might need those services find out what those choices are and what would be the best fit?
Good questions. I had to make a cheat sheet because we do have a number of agencies providing services in the county, and I don't want anyone to feel slighted. Applewood Centers provides services, Beechbrook, Belfair, Catholic Charities, Ohio Guidestone, obviously the Nord Center, the Lackawanna and Pathways all serve youth and families in our county. And there are a couple of ways to seek resources regarding outpatient care. There's a local navigator line that folks can call if they're interested to say, where can I get my youth in most quickly? Or, for instance, I have a 3-year-old who needs to be seen. Which agencies can I take this 3-year-old to? And then also, our Our website, the Mars Board website, has a full list of every agency and what services they provide. So those would be two of your quickest way to access those services.
Awesome. Thank you very much. And we'll be sure to put that link to the Mental Health Addiction Recovery Services Board website on our Facebook page and online as well. So, Rebecca, I know that my child's school has a counselor, or even some schools have counselors. What's the difference between what they can do for my child at school versus what they may services they may seek at another mental health agency?
Absolutely. What's interesting is there's been a trend toward not just school counselors, but school social workers who work for the schools, and they address most often school-based issues, as well as planning for what classes you're going to take next. So they can address the here and now issues, and some of them are able to do a little bit of counseling. When our agencies are in the schools, and we do have agency representatives in all of the 14 districts in our county, they can begin to assess for greater clinical needs. If a youth needs trauma counseling, if they need home-based services, or if they have issues that might be too upsetting to discuss during the school day, they can be seen outside of the school day.
And this next question is actually going to dovetail into our next segment. So if I'm in Lorain County, what do I do if my child appears to be in crisis? And we'll start with a little nugget of that, and then we'll come back to it after the break.
Sure. There's actually no wrong way. There are 3 numbers you can call to access crisis services for youth. One of the newer numbers is the MRSS hotline number. And I'm going to say the number, and maybe we can list it as well. That number is 1-888-418-6777. You can also call the 988 number and say, I'm looking for services for youth, and they will direct you to MRSS services, as well as the Nord Center crisis line, which you know, but I'm going to share, 1-800-888-6161.
And as Rebecca stated, we will be posting those numbers on our Facebook page, and they are on our website, as well as the Mental Health Addiction Recovery Services Board website. And as you heard, we will come back after the break and talk more about crisis services for our youth, so stick around.
May is Arthritis Awareness Month, but the Arthritis Foundation fights for people with arthritis all year long with life-changing solutions and medical research while giving people ways to connect and break down barriers to care. Walk to Cure Arthritis creates community connections, tools, and resources, and supports research for better treatments and a cure. Rock the walk and say yes to conquering arthritis. Register now at walktocurearthritis.org. Sponsored by the Arthritis Foundation, Inc.
Those headaches and stomach aches your child gets may be migraine. 10% of children and 28% of adolescents have migraine disease. Migraine at School can help. Learn more at migraineatschool.org. As a parent, I know how migraine impacts my daughter's ability to learn. Every child deserves the chance to flourish in school. Visit migraineatschool.org. Sponsored by the Coalition for Headache and Migraine Patients.
This is the story of a very special woman. Just a few knew about her superpowers. In a matter of seconds, she turned herself into a great mathematician. She masqueraded as a regular person at work, but as a superhero at home. Everyone knows her as Gabriella. I still call her Mom.
Your hero needs you now, and AARP is here to help. Find the care guides you need to help, complete with tips and resources at aarp.org/caregiving. Brought to you by AARP and the Ad Council.
Victor deployed for the first time to Afghanistan in 2003. He sustained a moderate traumatic brain injury. One of the most important elements of caregiving is taking care of yourself.
For many military veteran caregivers, their caregiving journey starts earlier in life and lasts longer. Visit aarp.org/caregiving for a free military veterans guide to navigate your caregiving journey and better care for your loved one and yourself. Brought to you by AARP and the Ad Council.
All right, and we're back, and I'm really looking forward to getting into our discussion regarding crisis services for our youth. But first, before we start, I want to remind you that the Nord Center is looking for terrific team members. There are a wide variety of positions available that you can see by visiting our website, which is nordcenter.org/careers, and you can even apply online. So again, we're fortunate to have both Brooke Sherman and Rebecca Jones with us to help shed some light on the behavioral health services available to our children in Lorain County. So we're going to get right back to crisis services. Rebecca, we talk about crisis services for children, and we know that the state of Ohio has developed a crisis delivery model for our youth. Can you tell us more about MRSS, the partners involved, and what those letters mean?
Absolutely. MRSS stands for Mobile Response Stabilization Services. And we began taking on this initiative approximately 2 years ago with our partners from the Nord Center and Applewood. And the idea really is to kind of shift the services to address the specific needs of youth and adolescents. So MRSS serves youth between the ages of 2 and 20, and it's in 3 phases. The first phase is a triage phase. Someone calls in and says, I'm having a problem. The second phase is the mobile response phase. In the model, when things are working exactly the way they're supposed to, a clinician can come to wherever the crisis is had. So a clinician could come to the home, to the school. If a youth was having a problem in the community, they could come there. And then after that initial stabilization or the initial outreach, a family is offered up to 6 weeks of stabilization services. And that team includes not just a clinician, but a peer parent mentor, somebody who has lived experience with struggling with their youth, and a case manager to help families connect to the services that they need.
So, Rebecca, the MRSS program, how does a parent or guardian or somebody that's with the youth know when it's right to call?
So that is a great question, because this is a little different from traditional crisis services. This is a family identified crisis. So a parent could or a caregiver could say, I don't know what to do. An example might be, I grounded my youth from their cell phone and they just slammed the bedroom door off the hook, and now I'm scared and I don't know what to do. They could call for that. I can't get my youth to get out of bed to go to school. They can call for that and have someone come to their home and de-escalate the crisis. The idea is we don't want to send youth to the detention center, to emergency rooms, to anywhere they don't need to be. Sometimes youth need to go to those places, but when we can offer services in the community before things get totally out of hand, then everybody wins.
And Rebecca, when is the MRSS model available? Is it during certain hours or?
So the cool thing about the call center is all you need to know is to call the call center and they will patch you through, and you'll either get the MRSS services or the Nord Center, who have been providing crisis services in our county for many, many years. The traditional MRSS model is available 24 hours a day, Monday through Friday.
Excellent. So the important note for all of you listening or watching on the podcast is, when in doubt, pick up the phone and call.
Absolutely. And that's the other thing about the triage center is, even if you just need resources, they can give you those resources as well. Even if you say, who should I call if I want counseling for my youth? They can point you in the right direction.
One other thing I wanted to ask you, Rebecca, is national news stories. You know, there's news stories about teen suicide that are really alarming. And can you tell us a little bit the story behind this problem of youth suicide and how it relates to our local region?
Absolutely. The issues in our county kind of mirror what is happening across the country. We collect data through the OYES survey, which rates youth's feelings of hopelessness, thoughts of suicide, suicidal ideation. And what we know is not that there's an increase in the number of deaths by suicide in teens, but that more teens are reporting that they feel hopeless, helpless, anxious, and depressed. And that's mirrored across our country. What I want to say, though, is, and this is the CDC reports these same statistics, there are 2 things in particular that can mitigate those problems. One is if an adolescent or youth is connected at their school, and 2, if their parents monitor their social media use and kind of where they are.
Well, thank you very much. And like I said before we started, this half hour has flown by, and I'd like to take this opportunity to thank both of our guests, Brooke Sherman and Rebecca Jones, for sharing valuable information. At the Nord Center, our mission is to engage people in the community to achieve mental and emotional health through treatment, prevention, and advocacy. We accomplish that by sharing the importance of mental health and the services available, not only at our organization, but across our community. We look forward to the next time as we explore not only these programs and how they can help you, but also the positive impact they'll make on our community. And again, we will also highlight the relationship that we have with other agencies in our community and how those important collaborations are centered around you. Thank you for listening and have a great day.
The proceeding was a paid informational program. The views and opinions expressed were not necessarily those of the staff, management, or advertisers of WOBL Radio.
Home of the legends of...